All right, everybody, welcome back to Magnolia on Money. This is Ed Cox with Magnolia Wealth Management. And today we have a guest in studio. We have Bill Smith. And say, hey, Bill, you're here on.
Hey, how you doing?
We're live. Bill's been on before. We've talked a lot about Medicare.
Mm-hmm.
He's back today. We've got just a few things we want to discuss that are I guess we're in another window of Medicare we want to discuss. At the end of the show, I'll put up Bill's information, and then Mark Schwartz also that's a partner with Bill. So if you need more information about what we're going to discuss today, you can definitely stop the video and get that. So we're going to try to make it quick. We're going to run through it, and
sounds good.
Let's get started. So I also have on the screen, let me get there for us. So here's our Medicare Enrollment Opportunities. So there's 4 of them there: IEP, AEP, OEP, SEP, and then there's a supplement changes that are year round. Let's jump in IEP. Let's talk about that real quick.
All right. The initial enrollment period is usually what we call aging in, where a person is turning age 65. They have potentially 3 months prior to the month they turn age 65 to enroll in Part A and B. They have also the month of their birth date and then 3 months after they turn age 65. Some of the individuals will still work. So if they're still going to be working, they need to go ahead and enroll in Part A, which is of no cost to them, but not Part B. If they're still going to be covered under their employer's health insurance, then they don't have to do Part B because they will have credible coverage, and we should have credible drug coverage as well. So that's the initial enrollment period. The annual enrollment period is what we've just finished. It was from October the 15th through December the 7th, right, which was a time where everyone who were in Medicare Advantage plans could make a change to that or change supplements or change drug plans. And so it was a limited time that's now over. Now, one thing that a lot of people are not aware of is OEP. OEP is the open enrollment period, and it's kind of like an OOPS in the sense that there are some people that they may not understand what they're getting into in a Medicare Advantage plan. Okay. It sounded good at the time. They thought they understood it at the time, but then, too, they start finding out that, well, they got copays and stuff on the back end. And it's almost as if they have surprises. It could have been explained to them correctly and them still have surprises, or maybe something had been left out. But during open enrollment period, a person who is in a Medicare Advantage plan can make one change between now and March the 31st, just one change. Now, if you're in a Part D drug plan, you can't change from Part D to Part D, but you could change from a Medicare Advantage plan back to original Medicare. Okay. But you have that one opportunity during the open enrollment period to where you can make one change from a Medicare Advantage plan to another Medicare Advantage plan.
So AEP annual enrollment period, that's the one
just passed.
December 7th. We're in OEP now, open enrollment period. Yep. That will end March 31st. And so that's what you call the oops. I messed up. This is not what I thought it was. Let me get that one-time redo for this cycle, correct?
Oops probably isn't a good word, but I think it's understandable.
Yeah, exactly. So special enrollment period. Let's talk about that a little bit.
Well, you'll hear a lot about special enrollment periods, especially when you get into situations that are going into the annual enrollment period and you've got bad weather and things of that nature, or COVID coming up to where a person didn't have the opportunity to exercise their changes during the annual enrollment period. So you've got that type of change. Then, too, you've got people who will move into an area from out of state or from another county. With your Medicare Advantage plans, those are county specific, so some could be offered in our area and not in another area, or in another area and not in ours. So if someone is moving in or out of an area, they need to make sure they understand what they've got to do when they move into an area, and also what they need to do if they are leaving an area, because you can't just bring a plan out of Florida and Alabama on a Medicare Advantage plan.
Right.
And even some of the Medicare supplements, they don't work well, although they should. But another thing that would be considered a special enrollment period would be based on a star rating. Every carrier has a star rating anywhere from 1 to 5 stars. And most of them are somewhere from 3 to 4 or 4.5 stars. on their overall service and things of that nature. But we have a new 5-star carrier in our area now, which gives people who have a Medicare Advantage plan an opportunity to look. They can kick the tires on it and see what it's like, and if they feel like that plan is going to be in their best interest to make a change, then they can. Of course, if they get into it and they stay in for the year and they decide, well, this is not what I thought, then during annual enrollment period for next year, they can go ahead and make another change.
So is that new, and a new carrier comes in, they're a 5-star, that's part of the special enrollment period that we talked about?
Yeah, it would be kind of like that. It's not necessarily a new carrier. You could have a carrier with a product that gains that 5-star rating.
Okay.
So you could have somebody, I'm not aware of one, that is a new carrier coming in that has that. What we do have in our area is a carrier that has gained a 5-star rating.
Okay, so this carrier was already here. They just just gained a rating. Okay.
Mm-hmm.
Good deal.
And then one of the things we were talking about was as it relates to supplements. One thing that you and I didn't mention was that this year the annual deductible for a supplement is going to be $233 instead of $203. And the Part B premium is going from the $148.50 to $170.10. So you can expect part of your increase in Social Security to pay for the offset in your Part B. But when you start looking at supplements are something that you're able to make changes in during the year. So you're not totally limited by an annual enrollment period. You're just limited by being able to pass any type of underwriting that you may need to go through. But there are carriers that are very lenient in their underwriting. And so when you get into a situation to where you have people 68, 69 years old, and now they're seeing their supplement premiums creep up, it may be time to look for another supplement.
Right. All good information. We wanted to keep it short today. I think we've done that. Anything we missed?
I don't know. We'll know whenever we're done.
Yeah, I think we're good, y'all. I'm going to put on the screen here Mark and Bill's information. So check them out. Call them. If you got any questions, feel free. Give them a call. They're open, ready to help any way they can. And once again, we do appreciate y'all for checking us out, and make sure you look at our Facebook page and also our website. You can get this information from there as well. So y'all have a great week. God bless, and we'll see you soon.
Thank you so much.